Hello and welcome to the Posture Dojo Podcast. My name is Sam Miller, your host on a journey of postural transformation, sharing some stories from my own postural transformation, diagnosed with an 85-degree kyphoscoliosis, and sharing stories and talking with experts from a variety of fields, some fields that you might expect when it comes to posture, and some that might be a bit more surprising. Our definition of posture here goes far deeper than just the spine, and that's why today I'm excited to have Amber Walker on the podcast. Amber, please describe yourself.
Hi, Sam. Thanks for having me. Originally, I have a background as a doctor of physical therapy. So the spine is something I have been familiar with for a very long time. I've worked with a lot of patients who have scoliosis over the years. But what I found as I started to work more with people who had chronic inflammation, chronic pain, chronic conditions is that I felt like we were missing the mark a little bit with these patients. It seemed like they had so much inflammation in their body and we just weren't quite figuring out the root issues for these patients to help them thrive again. And so I, through my own personal journey, kind of discovered more of the natural and functional medicine world and realized how much systemic impacts really have a role in this inflammation we're seeing, whether it's the spine, the shoulder, really anything orthopedic. There's such a huge overlap there. So that's become a big passion of mine and a big message that I want to share with the world is how important things like toxins or the gut health are for our physical body as well.
You mentioned a systematic impact, and that's truly something that's really overlooked for most people who are dealing with some type of extra curvature in their spine. Usually the conventional response is very physical. They'll see a curve in the spine, they'll measure the angle, and they'll suggest either bracing or scoliosis. Or if you're lucky, hey, let's get you a Schroth-trained physiotherapist, right? A rotational angular breathing specialist to help you kind of learn how to breathe and counter this derotation that's happening. But most of the time, it's a very physical approach. So, but I am optimistic that we're seeing this kind of movement towards more holistic treatments. And it's sometimes called holistic and sometimes it's called psychosomatic. I see that you're in this world of functional. How do you kind of define and differentiate between those?
Yeah, that's a great question. I think that kind of the traditional model of functional medicine is taking the concept of mainstream and tests and looking for things and coming up with a solution and going into more high quality testing that's really looking for the root of inflammation instead of just diagnosing somebody with something, but figuring out what is the underlying cause of inflammation, whether it's something that's bacterial off in the gut, whether it's hormonal, thyroid related, heavy metal, other toxin based, other things that can happen in the gut. Functional medicine practitioners tend to be more detectives looking under the surface at what's going on. Now, I think there is a movement now that's even going a step further, or maybe a lot of people who started out in functional medicine are starting to go even more towards the naturopathy model or other ways, because sometimes I think just like mainstream medicine has this kind of concept of a pill for every ill, I think sometimes functional medicine practitioners can get too much tunnel vision on these tests and labs, and then as well as supplements that they might be suggesting to people. So it's kind of like this concept of spot treating something, but maybe using a slightly more natural approach in the mainstream system, but still it's not always getting to the root issue. So I consider myself sort of a modified functional medicine practitioner. I have the training in it, but I've sort of gone even further, I think, into left field a little bit in terms of working on things that aren't just, oh, this slab is off, let's try this. I use a lot of energy work. I use a lot of nervous system healing with my clients. And I also am trained in some techniques like mind, body, spirit release and ways to help us, our bodies, release emotions in that aspect of our health for our healing.
I have a feeling that people come to you when they haven't found a diagnosis or a solution with the conventional doctor. Is that how it goes?
Very common, yes. I'd say a lot of people have seen dozens, if not hundreds, of practitioners. Sometimes they feel like they have a mystery case, or they feel like they've identified a ton of things with these functional medicine docs, and they've tried a lot of treatments. A lot of the patients I see have tried Lyme disease, often for treatment for Lyme disease for years, and still feel like they're getting worse or they've plateaued in their progress. So it is pretty fun to be a detective and to try to figure out what I call sort of What is the root of the root issue going on with this person?
So the big question that I was looking forward to asking you is, how do you heal something that you don't know what it is and where it's coming from?
You do know what it is with a little bit of digging, I guess is the best way to answer that.
So how do you
And
dig, I guess is the question.
yeah. There's a lot of tools. For me, I don't follow protocols. I don't follow the same approach for everybody. It's very customized. But what I find is really helpful is to start with a really thorough history. A lot of times practitioners don't have the time to really go deep and to get clues from history. And there's a lot that you can gain from that. Some patients come to me and they've had hundreds and hundreds of functional medicine type labs and tests. They've got a bunch of urine samples, stool samples, blood work, hair samples, you name it. And so they don't really need that. They already have collected a lot of data. They have this huge resume of sometimes 30 different functional medicine diagnoses that explain inflammation. But that doesn't really help us with triage. It doesn't really help us figure out, well, what's driving inflammation today? What do we do with all this information, with this perfect storm of inflammation going on in the body? And so I like to take it a step further and give patients the option to do some autonomic response testing or muscle testing to figure out what today in this moment is the body trying to signal us and wants to clear. And then I also like to dive a little bit more into autonomic nervous system work, the limbic system. We can see a lot of shifts just starting to work on the angle pretty early on, as well as there are ways to do some autonomic response and muscle testing to figure out where specifically emotions might be stuck or creating stagnation. In the case of my patients that have a lot of spine pain, it's really interesting because we'll muscle test each level of the spine one by one. And there tends to be certain levels that are harboring certain emotions that we can then clear through different techniques. So there's a lot we can do if we start to zoom out a little bit and think outside of the box. So I very much am passionate about avoiding the spot treatment approach of, oh, you have SIBO, this small intestinal bacterial overgrowth in my gut, let's just do this protocol for it. I think we really need to step back even further to help these patients heal, because generally it's not just one thing. There's usually dozens of things going on all at once.
This is something that's very close to my heart, literally, because there's a new understanding that has been shown that people with scoliosis have a contracted spinal cord. So proportionally, their spinal cord, that noodle that extends from the brain into the nervous system throughout the entire body, which is woven throughout the spine, is contracted. And during those teenage years of rapid growth with the spinal column, with a contracted spinal cord, you get a warping that you see in scoliosis and kyphosis. And which to me just makes so much sense to be like, okay, why aren't we addressing the signaling and the contraction and the tension that's happening between the brain and the body, and kind of analyze what are those emotions that are there. And over the past year or two, I've been diving much deeper into this, diving much deeper with this understanding into my own body, and starting to really, the same way you watch your form when you're doing a physical movement, I'm watching my thinking patterns and my emotional patterns that I'm doing and that I'm carrying with my breath throughout my body. If I'm feeling tension in certain parts, I'm bringing awareness to what I'm thinking and what thoughts I'm holding in my mind. And with my breath, especially in that exhale, that 8-second exhale, I'm re-educating, I'm reprogramming the thought that I hold as I kind of bring my awareness to that part of my body. Does that make sense?
Yes. Yeah.
So
absolutely.
So to me, this is like at the key to unlocking a lot of these postures, because if you look around online, a lot of the exercises that are suggested are really just stretch and rotate the body in the counter direction of the twist that you have in the spine, and that's the way. But I see that as pretty futile if you're not addressing that root cause, that root tension, which is actually limiting the alignment and the elongation to happen.
Absolutely. I think that's key. There's so many points you just mentioned that I'd love to go deeper on. But I think when we look at even just an organ in the abdominal cavity or the chest cavity, and how we can have physical stressors there, but we can also have mental, emotional, spiritual stressors there that are causing an asymmetry, that are causing something to be off alignment, that are causing a pull, that are causing an inflammatory response or a stagnation in your lymphatic flow, for example. an alteration in how the nerves are functioning. Any of these things can, I think, impact these cases quite a bit. And when you talked about breath work and you talked about that nervous system practice, I think that is huge. And that is such a beautiful and important concept with all of this. And I think with a lot of patients, what's going on is they tend to start maybe with some top-down approaches. When I say top-down, I'm thinking more like conscious approaches to helping repattern and reprogram our thoughts, right? So they might start with things like that. But what a lot of these patients, especially the ones who have been through a lot of trauma, find important is to also do some subconscious reprogramming work and some bottom-up work where we're giving the body somatic signals of safety to help that autonomic nervous system recalibrate and rest in a place of safety where we can then have less tension hypothetically in certain areas and have better flow of things and have our body's homeostatic mechanisms work a little bit better. So I think that it's really great to have both approaches, the top down and the bottom up. With our autonomic nervous system, a lot of times what I see a lot with scoliosis is a lot of people are stuck in a freeze type pattern or a dorsal vagal tone pattern. We have this nerve called the vagus nerve. I don't know if you've had anyone speak on it, and I imagine in previous episodes, but essentially it's a nerve that goes from your brain down to your gut with a bunch of branches. And it has different pathways that light up depending on our perception of safety. So as we're kind of scanning our environment for clues, and parts of the brain are responsible for this, we will tend to either be in a place of peace and joy and connectedness with others, or we can go into that fight or flight that most people are probably pretty familiar with. But there's also this pathway called freeze that's very common. It's not as commonly recognized when you're in it. It can be subtle sometimes, but it's essentially a mechanism of survival that we have where we curl up in the fetal position or in a ball and things just kind of stop. We lose a lot of circulation. A lot of different things happen with, for example, our psoas muscle, hip flexors, other muscles that we have, spine muscles. And so I think that's a big part of what's going on for a lot of people too who have chronic pain is they tend to fall into that pattern with the autonomic nervous system.
Absolutely. It's a very common one to come in front of this freezing pattern. I know in my hips I had a lot of freezing going on. Sometimes it's emotional. Sometimes it's emotionally kind of bracing yourself or emotionally trying to do something which isn't congruent with the reality, the opportunity. So that can create a tension. And sometimes it's bracing, protecting. I believe in my case, a lot of it is after a near drowning trauma. I sprained my hip and groin, and I think during the rehab process, when it's so delicate, and there's months there where you're kind of protecting yourself and you're bracing yourself. And for me, I think it was actually the actual trauma can create the injury, but it's also that if you're not rehabbing correctly, if you're just kind of bracing and getting through it, there's a lot of patterns and locking up that can happen in that actual lack of rehabilitation process. And I believe that was what that was for me. And ultimately, what's that emotion that's going through my head as I'm protecting myself? I don't feel safe because I have this injury and I'm kind of bracing myself. And so to heal, I'm finding sometimes, as you were saying, like bottom up, right? Sometimes you don't want to start with a thought. You want to start with what you said, somatic signaling, right? So you signal safety and you signal, I guess, health and a great state. And then you're allowing the body to kind of present itself, the energy that might be trapped to present itself. Walk me through that, maybe.
Sure, absolutely. To touch on what you just said first, I think that one other thing I notice with people a lot is that there is a pattern of intergenerational trauma. So a lot of times when kids develop scoliosis or it's adolescents or earlier on, there might also be a component of emotional trauma from generations in your family line that are impacting your physical body today. And so that piece can also be pretty pivotal to work on is not just your own perception of your own traumas, but keeping in mind that you might be carrying things that your body's ready to release that don't originate from you as well.
So you mentioned intergenerational trauma can be a pattern that that becomes imprinted and something we have to face. And as you were saying, it's subconscious. So trying to go at this with the thought and thinking and you're coming, that's the top-down approach. So this bottom-up is going into bringing awareness to that space beyond words and allowing that energy and emotion to be released. Is that more or less the process?
Yeah, and so a lot of times we'll start with something like an auditory program, a music-based program to help the autonomic nervous system get the signals of safety from a bottom-up approach. So this isn't therapy or going through EMDR or techniques that work on trauma, although there's nothing wrong with those approaches, but this is a very subconscious process where we're using music in this case that is specially programmed at certain frequencies and tones to help retrain the middle ear muscles, like the tiny tensor tympani or the stapedius muscles, these little muscles inside the ear. It's basically helping them kind of hit the reset button and recalibrate what they're scanning the environment for in terms of sound frequencies. So if we can shift what our ears are in tune with, then our autonomic nervous system can automatically let out a sigh and rest at the top of what we call this ladder on the polyvagal theory perspective of that ventral vagal tone, that place where we feel peace or connected. And so a lot of times to just jump people into a program or a protocol, there's a lot of great online programs out there. But for a lot of these patients, the program approach is more top-down heavy, or it's not really customized to them. And so sometimes exercises for the nervous system to help bring this subconscious angle can actually be a little bit triggering. Not everybody responds well to breath work, for example. Some people love it, but for some people, it actually sends them into deeper freeze or fight or flight. And so a lot of times I start people with really simple somatic exercises, more bodily based exercises using light touch. And once we find a couple that people like and that work to help ground that nervous system, then we can kind of bring in the big hitters like these music programs or these other things that might really help that bottom up approach be even stronger.
Interesting. Yeah. So there's on the side of Mexico that I'm in, there's a lot of holotropic breath work. I've enjoyed that to go very deep into the system. That's pretty deep breathing for 20, 30, 40, 60 minutes, taking your body into different states. There's in plant medicine, sometimes when you're shutting down that ego consciousness, there are some new awareness levels to bring into your body. I'm curious, you're out in Mexico, you're integrating a lot of these type of holistic therapies. What types of practices? You mentioned some sound vibration. I absolutely believe that is a way for us to truly kind of adopt and become that sculptor of our own body as we're receiving these sounds, but also with that sigh, that's literally like we're starting to actually add vibration to our breath, and that vibration can be quite healing, especially to bring the body out of that frozen state that it might be in. So what other things are you kind of working with the people you work with that you see the value in?
Great question. I could ramble about this one for a long time. I'll try to keep it concise. I would say it depends on the person and what they've explored. A lot of the people that come to me have really tried a lot in terms of nutrition, in terms of movement and exercise, in terms of nervous system work. And so for some patients, we really dive deeper onto topics like toxic burden and helping open the detox and drainage pathways and working on parasites, which I want to touch on because that's really important to kind of have on the radar with scoliosis. But the foundational things, clean air, clean water, clean food, some of these things that seem really simple, spending 5 minutes in stillness a day for so many of us, especially if we're in a more westernized culture and grind culture, we don't give ourselves the time to be still and to let emotions come up and to release them. I think that official strategies to help release emotions are also really powerful. There's many approaches out there, but I like to use mind, body, spirit release with patients. So that could be another helpful tool for this work. We often integrate the sound healing, but also the somatic work. But I also have people really explore things that help them get in nature, that get fresh air, that help them ground, all of these things. I think that EMFs, even as a theme, there's so many angles I work on with people over the course of time to try and help lower inflammation and help bring their body back to this balance with the autonomic nervous system. And EMFs is one that I think doesn't get talked about maybe as much with the scoliosis population, but there's some interesting studies that even look at if, when I talk about EMFs, I'm talking about electric and magnetic frequencies, right? So those could be coming from things like our cell phone or our appliances in the house or Wi-Fi, cell towers, et cetera. And with EMFs, there's some interesting studies where people actually shift their postures away from the source of, say, where the Wi-Fi router is or the biggest source of EMF in the house. And so when I think about people who have postural deviations in some way, if you're always sitting at your computer one way or always looking at your phone and tablet one way, sure, that can definitely create some postural things from like that physical therapy perspective. But I also think our body responds to the bigger picture energies in our field. And if we have a bunch of sources of EMFs around us, even just a cell phone in our pocket or our purse, and it's always held on the same side, that's going to probably play a role in how our body's modifying our posture away from that, which could contribute to some of these anomalies we see or tendencies to have asymmetries.
Yeah, just on that one, even the EMF may be in play there, especially right next to the reproductive organs. That's something to be careful about. I keep my phone away from the pocket as much as possible these days. There's also just your perspective of that digital environment. If you work on your phone, if you have a stressful situation on your phone, you have this kind of in the corner of your eye, but in the corner of your body, right by your hip, you have a quite a strong force of it might be stress, anxiety, different emotions that you might be experiencing when you go into that digital environment, right? Depending on your relationship with it. So that as well kind of needs to be considered there. And it sounds like a lot of what you're doing is really undoing a lot of the patterns that have come from modern life.
That's the aim. And it's trying to look and, like I said, think outside of the box, because a lot of these patients also have clues from their dental history, their oral history. We know with scoliosis, there's a big connection with tongue tie, for example. I also wonder about cavitations or root canals in these patients or some of these other things that can cause systemic inflammation that can impact our nervous system. And really anything that impacts the brain, the spinal nerves could cause the spine to go out of alignment. So we have to really zoom out, I think, with the theme of scoliosis and look at all of the angles. With these patients, I see a lot of organ inflammation. I do see a lot of emotional trauma across the board, really, with anybody with chronic illness. But I also see a lot of GI issues, a lot of digestive issues, a lot of people who have dysfunction in the valve that connects the small and large intestine, for example. I see that a lot. And I think that's sometimes correlated to the side of the curve, depending on where the curve is. I see a lot of people with chronic constipation too, or chronic digestive issues. And one thing that I really wanted to touch on that I'm gonna shake things up a little bit here, but is there are some studies that look at parasites and scoliosis. I don't know if you've ever done a deep dive into the topic. Very interesting, but we don't have amazing randomized controlled trials. Obviously, that'd be a little bit unethical in this idea of parasites, but there are some interesting human and animal studies that look at this. And so the one that I recently read was about this alpaca. It was like a 2-year-old alpaca. And it's had a pretty severe cervical spine curve, and they were trying to figure out what was going on with it. This animal was like getting physical therapy. It had a kind of an integrative practitioner it was working with, and they ended up discovering a parasitic infection that had basically impacted the whole nervous system in the spine and the nerves around the spine that was causing this. And they have tied that back to in other animals like camels and horses too. They found a lot of that. But in humans, a lot of times in spine surgery, they might be looking at maybe a herniated disc, for example, and they might go in and find some worms in there and pull them out. There's tons of case reports about that. So not to gross people out too much, but I do think that there's a lot of systemic influences on our spine that we want to be aware of. I don't think that this is the number one cause of scoliosis in each and every person necessarily, but I do think that there's a huge interplay between our gut and the rest of our body, and parasites aren't just in our gut. Parasitic infection is everywhere. Now, one of my mentors says, if you have a pulse, you have a parasite. So I think a lot of people, especially in, let's say, the United States, think, oh, parasitic infection is just if you travel to such and such country and you eat street food or something, but that's really a myth. My patients all over the world have a lot of parasitic activity. And if you've ever had a dog lick you, if you've ever eaten raw sushi, if you've ever had raw fruits and veggies, walked barefoot through certain areas, there's so many ways that we can get exposed to these bugs. And so I think that it is important to have on the radar and to look at that component with these patients, look at what's going on in the gut. The parasite testing out there is really poor, unfortunately. It's very hard to diagnose that part. And so I rely on some of the muscle testing, like I was sharing, and some other ways to figure out if this is going on with people. But the other thing that's important when we're talking about this theme is that diving in and hitting parasites really hard with herbals is not necessarily safe for everybody or the right approach. For a lot of these patients, what they need first is detox and drainage pathway support. They need to start working on toxins first. Parasites feed on toxins. And so working on that piece tends to lower the inflammation quite a bit. In my patients that have spine pain, it can completely reduce their spine pain just by working on lowering toxins alone. And then we can kind of go into the gut piece and really addressing parasites systemically, not just in the gut. It tends to be really helpful for these patients too. So that was a little clinical gem I wanted to share that I think doesn't get a lot of airtime in this community yet.
Yeah, absolutely. When I think about what the nervous system reaction would be to a parasite, it would be that same contracting, that same bracing process. So yeah, it's absolutely something to look at. I know after leaving the doctor's office at 18, not being a candidate for surgery and not really being presented a viable path to heal or to do anything about it really, I was just kind of had to live with it. I just lived with it for about 15 years until I was about 33. And then my body started shutting down. And it was the first thing that appeared was the digestive issues. So inflamed lower belly, my immune system, I was getting pale, I was getting chronic fatigued, and I was getting the symptoms of literally being choked out. And when I went to the doctors, oh, it's IBS, here's some antibiotics. And it just didn't feel right, so I didn't do that. But it's certainly, I think a lot of people with IBS could definitely put on their radar these types of structural contraction happening in those areas or different things going on in those areas, because that's how it presented itself. And I have a feeling a lot of people who are being diagnosed with IBS might have some, I'm not saying they do, but it's worth looking at these type of structural issues. Is that something in your experience that you've noticed?
Yeah, absolutely. The gut-brain connection is very strong. So I think it can go both ways. Sometimes what came first, the chicken or the egg, is something we can think about too, especially in our modern age and the diet that we tend to be using at this point that is pretty toxic in terms of what we're putting into our bodies. Yeah, I think that it could certainly go both ways in terms of what's triggering what or what tends to be driving the inflammation. But in my experience, I think that toxic burden is first and foremost the thing to educate people on, because that tends to set up our gut environment for a stubborn biofilm or layer where microbes and different things like to hang out. That makes it harder for us to reduce lower inflammation if we have a lot going on that way. So toxic burden, whether that's coming from things like heavy metals and chemicals in our food, water, chemicals that we're breathing. Mold is a big one. I see a lot of patients who have lived in moldy buildings, and you don't have to be actively living in a moldy building to be sick from it. You could have been exposed when you were young. You could have been exposed decades ago and had those mycotoxins build up in your system. So that's a really big one for people that can drive a ton of inflammation. I've been working a lot with patients who have long COVID, and that tends to be a pretty common factor across the board for those folks. I would say in most people who have chronic inflammation, there's some degree of the mold piece playing a role. So a lot of people are like, oh, I don't live in a humid place, or where I live is dry. There's no way it could be in my house, but it can hide and it doesn't always smell. So it's certainly something to have on the radar as a part of this zoomed out look at what could drive systemic inflammation. There's a lot of other types of toxins that we're exposed to, glyphosate, industrial chemicals, even ones that might come from vaccinations, which is obviously a controversial topic nowadays. But I do believe that it is important for us as we're humans coming into this modern era to really be aware of this stuff, but without fear. We don't want to have a fear-driven response to this stuff or think that we need to live in a bubble or feel helpless about it. But I think it is important to have it on the radar, to address the hardest hitting areas, so to speak, or to figure out what's impacting your body the most. And by helping the body's pathways clear them and heal that, people tend to have a massive reduction in whatever is going on orthopedically, especially around the spine. I see that having a profound effect. So again, looking at the toxic burden, looking at the gut, all of these factors are so important for these patients.
So you have some offerings online, but you also do in person. How much can you help someone remotely, and when is it time to do in person?
Great question. I really appreciate being able to do both, but I'd say the majority of my patients I do work with virtually because they aren't able to travel or don't have the time to travel for whatever reason. And so I do video calls with patients all over the world. That's something that we can do pretty easily. If patients want to order labs, we can order them from afar. If they want to do muscle testing, there's a way to do that. So there's a lot of ways to work together from afar and see the results that we want. So that tends to be probably my most popular offering. However, I do have weeks where patients will fly to Mexico and we'll do a lot of one-on-one care for 5-6 days in a row, really going deep on these themes and topics. And that is another offering that I appreciate. Although I don't tend to do it in rainy season because it does get very hot and humid. I live down in Nayarit, Mexico. So that's something that certain months of the year is an option for people. And then I also have groups that meet virtually. So some people like the group format. It's also helpful to be in a group with people, other people who get it, and to have that social support. But the groups are something that tend to start up every couple of months. I think the next one's starting up in May. So a lot of options to work together if people want to tap into that one-on-one care or a group format.
Beautiful. Okay. And so what would that, if someone's with some of these postural deficiencies, what would that week look like in Mexico?
The week in Mexico, we tend to start out with longer sessions in the morning and then shorter sessions in nature in the afternoon, depending on whoever comes down that week. There might be a group of others that week, or you might be the only one in town. So generally we'll do hands-on assessment, and it's really what we've talked about here, looking for those bigger physical root issues. We do get into things with hands-on care for scar tissue work or nervous system retraining, or even using tuning forks and different strategies, or hands-on emotional release techniques. A lot of that's fun to integrate while people are here in person. But it's also important to have that foundation of looking for those root issues, kind of being a detective and figuring out what's going on for people. So we do a lot of nervous system work that week. Mexico is a wonderful backdrop for that. Just sitting on the beach and doing some somatic exercises. It's amazing what that does for the health. So there's a lot of things that we integrate. It's really kind of a customized approach. I don't have a protocol, so to speak, with the Mexico trip. We meet before you even get here to figure out what your needs are, what you've already tried, what your goals are, and then we customize the week from there.
That sounds amazing. What do you have your healing sanctuary already? And if not, what would it be? What would your ideal healing sanctuary look like?
I have it up here in my head. I'm definitely dreaming up creating some type of a healing retreat space. But right now we are using other facilities in the area. And this is an area that has a lot of healers, a lot of natural medicine, a lot of plant medicine, a lot of body workers, a lot of incredibly talented healers here. So it's really a wonderful place to be for this type of work. There's a lot of different settings for us to, physically be in that week that people are here. There's also a lot of add-ons if people want to integrate other types of services to the week to kind of create your own retreat experience. There's a lot of options to do that. But I'd say my ideal healing sanctuary is definitely in nature. That's a big one for me. I'm also really happy on a surfboard though. So surfing is something that for me has been actually really helpful for my own spine concerns in terms of getting stronger in a functional way and having it not be a bunch of exercises that I'm just in the house spending an hour or two a day doing, but actually going out into nature and getting that connection with others and that connection with nature and that flow of the ocean has been really powerful for me. So that is an option when people come down if they want to have an adventurous trip. There's a lot of ways to learn how to surf or to paddleboard while people are here, to get out on the water. Tons of opportunities, but that's the beauty of being in this part of the world, is that there's a lot of powerful healing and a lot of powerful energy particular to this location too.
Yeah, and the fun part of functional holistic medicine, a lot of it is getting back to your roots, getting functional and having fun, right? When you are having fun, your nervous system is in a great state. So if there's things that are getting in the way of that, then you have the tools and the healers and the people around you to be able to do that. So I think that's a much more likely path, because the hardest part, I think, in my experience, as I'm on this mission to help people, is like getting them to do things. And if they see it as a chore, if they see it as work, something they have to do, then they're less likely to do it. Whereas as you've kind of built in your own life, you've created a lifestyle that naturally is healing, right? You're not doing the healing, you're doing life, and that life is beneficial and healing. And that's the way to live, I think. So, because why not? We don't have to follow the modern patterns of the people around us that can stagnate parts of our bodies, parts of our minds. So a very beautiful mission you're on. Thank you. I want to appreciate you for the work you're doing, helping people. I guess you're using a lot of experience, you're identifying patterns that you see in people and then helping them kind of overcome issues that they're facing. So please tell us, like, who are you ideally looking to work with, or what kind of people come to you, and where can they find you? We will include links in the description as well.
Yeah, I really appreciate patients, whether they're first exploring these topics and they've never thought about many of these things, or they've been working for years and feel like they're missing something. I really appreciate all types of cases, all types of complexities. I would say depends on what we're talking about. For the groups right now, I'm focusing a little bit more on long COVID or patients who have been sick after a virus or maybe after a vaccine for the group setting. But in terms of one-on-one work, in terms of coming down to Mexico, it's pretty wide open I'm looking for people who are open and curious and open to exploring mind-body connections as well as the physical piece. I think that's a big one, because I think that those patients tend to see faster, more profound results. That would be kind of the ideal client. And I just wanted to thank you too for all that you're doing to educate and empower. It's so important. So thank you for putting all this information out there to the world.
Thank you. And what's the best place they can get in contact with you?
So the practice is called Origin Wellness, and the website is originwellnesscolorado.com. I'm also on Instagram and Facebook. And then I do have 3 books. So my author page is Mast Cells United, or the website is mastcellsunited.com.
All righty. Dr. Amber Walker, thank you very much for coming on the podcast and diving deep into the systems that govern our body, that we can learn and understand and encourage to their original states of health and flow and vitality. So thank you for coming on, and thanks everyone for listening.
Thanks so much, Sam. I hope that everybody leaves with a message of hope, because with the right tools, the body really can heal this stuff we're talking about, and that health and vitality and thriving again is possible.
Amazing.